In this week's episode of Health Across the Islands, Venezuela's earthquake recovery brings new health threats. Power shortages deepen Cuba's healthcare challenges. Saharan dust returns across the Caribbean. PAHO urges country to prepare for El Niño health impacts. WHO warns cancer cases could nearly double by 2050. All this and more when we return on this week's episode of Health Across the Island. Thank you for joining us on Health Across the Islands, your Caribbean's weekly health news briefing. I'm your presenter, Natasha Robinson-Connor. 2 weeks after devastating earthquakes struck northeastern Venezuela, health officials say that the emergency is shifting from rescue operations to preventing disease outbreaks and restoring essential healthcare services. The Pan-American Health Organization PAHO says communities affected by the earthquakes continue to face significant health challenges. Damage to health facilities, interrupted water supplies, and overcrowded temporary shelters have increased concerns about infectious diseases. Health experts warn that stagnant water left behind by the disaster could increase mosquito breeding, raising the risk of dengue and Zika. Disrupted vaccination services also heighten concerns about vaccine-preventable diseases such as measles. Reports from affected communities indicate increases in diarrheal illnesses and worsening conditions for people living with chronic diseases who have struggled to obtain medications and routine medical care. PAHO says restoring primary health care, ensuring access to clean water and sanitation, strengthening disease surveillance, and supporting mental health remain top priorities as recovery continues. Persistent electrical shortages are placing additional pressure on Cuba's healthcare system, affecting patient care and hospital operations across the country. Healthcare facilities continue to experience prolonged power outages that have disrupted surgeries, diagnostic services, and the storage of temperature-sensitive medications. Power interruptions have also affected refrigeration for vaccines and medicines, while patients requiring dialysis, oxygen therapy, and other critical services face increased challenges. Reports indicate that more than 100,000 surgical procedures remain delayed as hospitals struggle with unreliable electricity supplies and shortage of essential medical resources. Health experts note that maintaining reliable electricity is essential for safe hospital operations, laboratory testing, and emergency care. The ongoing situation highlights how energy security is increasingly recognized as a key component of health system resilience. Several Caribbean countries are preparing for another wave of Saharan dust expected to reduce air quality during the coming days. Meteorological agencies across the region have issued advisories as moderate concentrations of Sahara dust move westward across the Caribbean. Health officials warn that the dust can trigger asthma attacks, worsen chronic respiratory diseases, irritate the eyes and throat, and reduce visibility. Authorities in Antigua and Barbuda, the Turks and Caicos Islands, the U.S. Virgin Islands, St. Vincent and the Grenadines, and the Cayman Islands have all advised residents, particularly those with asthma, COPD, allergies, heart disease, older adults, and children to limit prolonged outdoor exposure when dust levels are highest. Residents are encouraged to remain hydrated, keep medications readily available, and follow local air quality advisories. The Pan-American Health Organization PAHO is encouraging countries throughout the Americas to strengthen preparedness as El Niño could increase a wide range of health risks. A new PAHO analysis outlines how El Niño may contribute to extreme heat, drought, flooding, and changing rainfall patterns that affect human health. Potential impacts include increased heat-related illnesses, expansion of mosquito-borne diseases such as dengue, disruptions to food production, reduced water quality, and increased mental health challenges following extreme weather events. Authorities are urging governments to strengthen surveillance systems, improve early warning systems, and ensure health services are prepared for climate-related emergencies. The warning comes as several Caribbean countries continue experiencing high temperatures and have shared heat advisories, including Jamaica and the Dominican Republic. The World Health Organization is warning that new cancer cases across the Americas could increase dramatically by 2050 unless stronger prevention and early detection measures are implemented. According to the WHO, population growth, aging populations, and exposure to preventable risk factors are expected to drive a substantial increase in cancer diagnoses over the coming decades. The organization says many cancers remain preventable through reducing tobacco and alcohol use, maintaining healthy diets, increasing physical activity, and receiving recommended vaccinations against infections such as HPV and hepatitis B. WHO is also urging countries to expand cancer screening programs and improve access to timely diagnosis and treatment, as they emphasize that investing in prevention today can significantly reduce future illness and death across the region. These are the stories making up this week's episode of your weekly health news briefing. Join us next week for more.